If you think good skincare can be found in a bottle, well, you're partially right. But as it turns out, laser technology is where it's at.
Emilio, what we're doing here today is treating a black tattoo with the use of the ruby laser. It hurts a bit, but most patients can tolerate it. I knew that this would be a real easy tattoo to remove, but I never thought that 20 minutes later you could see a marked improvement.
Steve, what is Spa Medica?
Spa Medica is a unique concept in cosmetic care delivery. And what that is, it's a marriage of the best of dermatology and skin laser procedures and cosmetic plastic surgery under one roof. Today you saw the latest in spider vein treatment, which means a Nouvelaise laser that can remove your linear, that is fine line spider vein, and you can get back to work that day. Is that hurting?
No.
Good for you, okay. If you have a large blemish, however, that needs a little more energy, you can have a pulse dye laser and have a little bit of bruising, but have a nice clearance of that lesion. What she'll feel is a little burny, stingy sensation, like an elastic band being flicked on her skin, but very tolerable. We then went into our laser hair removal rooms, and we want quick, affordable, long-term depilation of the hair, not permanency. There is no system on the market today, and I've tried them all, that is permanent. So what I can do with this is I can write online with the patient sitting there, say, okay, you don't like that thigh, there is a reasonable expectation after. Not perfect, there's still a little takeoff, but a nice improvement. There's very few things that at Spa Medica we can't treat because we have all the technology available. Our mandate is the best quality of service, and our mandate are happy patients that are treated safely.
Okay, let's say you've always taken care of your skin, okay? You used your eye cream, you wore your sunblock. Well, congratulations, you probably look really good for your age. But what do you do if you have an age spot or some sun damage, or maybe you've got some broken blood vessels? Do you have to just live with it? Well, you don't have to if you don't want to. We went to Spa Medica, a cosmetic surgery clinic in Toronto, to find out about the latest in corrective surgery techniques, which include a leg vein treatment that's the first of its kind in Canada. Well, here you go. The first time Images has attempted a laser light show, so just watch this.
Okay, come on in, Hazel, and lie back and relax, and we can get going. Now, leg veins are a very, very common problem. Probably 600,000 to 700,000 treatments a year done for unwanted leg veins. They're a problem for women because they're a cosmetic blemish. Some of the more severe ones, the big varicose veins, can be actually symptomatic, and that's usually covered by the insurance plans of most provinces. This device is really for the deep blue veins and the very superficial veins. What I mean by deep blue is you can see this combination right here. This little constellation has a big deep blue guy here that when I compress it, it disappears, and when I let go, it comes back. And then a number of little superficial guys hanging out around the periphery. Now those will show through nylons, and if you wear shorts, they can be unattractive. And in the past, we would have had to use a needle definitely for the big blue ones. And maybe a laser might have helped with the superficial ones. This device has two treatment arms. The first arm, it looks almost like a gun, and it shoots an intense laser beam from the end of it that will close off the big blue vessels. The beautiful thing about this as well, in contrast to needle treatments or outpatient surgery, is that it's very fast. In 15 minutes you can cover large areas of the leg. The other side of this is what we use on the superficial veins. Those are the tiny little spiders. And this treatment head and the filter through which the light comes is an intense pulse light that closes off the very superficial spiders. So in one box, driven by software, we're able to set the parameters to treat the big blue ones and then the superficial little ones very quickly and very affordably. It is a laser, so we have to protect our eyes, and we have to always be concerned with safety, so everyone does wear goggles for this type of procedure. And I'll just put my glasses on. We don't need to do anything fancy to protect the skin, just some gel. And I'm going to get Terry to put some gel on. Terry, we're going to treat this big spot here. Laser technology changes very rapidly, and in this clinic, I'm fortunate that we have about 8 or 9 lasers that we can apply to any given problem, which is why the center is frequently visited by people, because you have a lot of options and we can point the right photon for the right problem. With the leg veins, the leg vein pricing varies on the amount of time you just want to spend doing it. And because it's a very fast system, we just charge by the 15 minutes, and it's $250 for 15 minutes. Now the brown spot laser is good for sunspots, aging spots in the back of the hands, the neck, the face, unwanted moles, flat moles that don't look suspicious in their growth, and inflammatory changes in the face if you've had a pregnancy spot or a sunspot. And how it works is it's another wavelength of laser, slightly different than the one in the hair removal, but it's gated, meaning that it releases the photons for short blasts. And that means that it doesn't go deep into the machinery of the hair follicle, actually stops right at the surface of the skin, is absorbed by the pigment in your spot, and it basically creates a crust. And when the crust comes off in 2 or 3 days, half your pigmented spot's gone. And the rest of the pigment is broken up into millions of pieces that your own body's immune system removes over about 6 weeks. So with one zap of the laser, and 6 weeks later your brown spot's generally gone. The odd person needs one touch-up, but usually one treatment's enough. Most treatments fall in about $150 to $250. So it's still out of pocket for people, but it's a service that they really want. It's simple, they can go back to work, no downtime. And so a brown spot generally be around $100, $150. And then every other brown spot is paid by pulse after that. So usually a few $100 you can treat every brown spot in your body that you don't like. The demographic of the people that show up for this has changed in the last 5 years. It's really any woman between 25 and 75 are our clients. The younger ones are very outgoing, energetic professionals, self-actualizers often, and they see something they don't like and they want it taken care of as quickly, efficiently, and effectively and affordably as possible. Is it vanity? People just want to look their best, and when they look their best, they feel their best. And it's about a quality of life, and cosmetic surgery is not for everyone. Laser cosmetic treatments aren't for everyone, but for those that it works for, it really enhances their sense of confidence and vitality, and they feel good and look good.
Okay, when we come back, we're doling out those kisses to the latest and greatest stuff from the world of beauty. It's the Images Product Road Test, and it's coming up.
I'm worth it.
Something a little different today, the removal of a birthmark right here at Dr. Steve Mulholland's.
What you're going to see today is the treatment of a birthmark. The beauty of the laser technology is that it bypasses the skin and goes right to the blood vessels, so that you get a very specific treatment and a fading of the actual blemish without affecting the overlying skin, rarely with any pigmentation change, and no scarring, which is what people are looking for.
So, Gail, how long have you had this birthmark for?
As long as I can remember, always as a child.
I see. And why have it removed now?
Well, I tried about 20 years ago, and the doctor, when he looked at it, felt that there could be muscle damage left after they removed it, or I may end up with a circle still there. And he suggested it wasn't really, because there was no muscle tone damage now, he suggested not to do it. So now the technology's here that can completely wipe it out, and I'm going to give it a try.
What we're going to do now is fire the laser in pulses at the blemish. As you can see, after every pulse of the laser, the blemish turns black and blue, almost like a bruise. And so what I tell patients with birthmarks is they don't have to do any skin preparation, they don't need any anesthesia, no freezing, they can just lie down and have it treated. The laser itself explodes under the skin the tiny little vessels that make up the blemish, and that's what the bruise is. As the bruise fades over the next 8 to 10 days, what Gail will find is that her blemish has lightened significantly. She may need 1 or 2 treatments spaced out by about 6 weeks until complete clearance is achieved. But I would say most patients with birthmarks get between 90 and 100% clearance of their birthmark after 2 to 3 treatments.
So, Dr. Mulholland, the procedure now is finished?
Yeah, Gail has completed her treatment. You can see the bruising from the laser, but in the words of Gail, I don't think it's very uncomfortable. In fact, most patients don't feel anything once it's completed.
I don't.
You don't feel a thing?
Nothing.
Oh, very nice.
It actually looks worse than it is. And then I put a little bit of polysporin, an antibiotic ointment on, just for the ride home. And then Gail can start using any soap and moisturizer she wants, and just sun avoidance with some sunblock, and that's all she has to do.
Wow, it's pretty amazing stuff.
It is, because a lot of these birthmarks have been there since they've been 1 or 2 months old.
Sure. And they
And
get,
as we mentioned in the break,
Yeah.
called the kiss of God, and it's really a hereditary thing. You can't do anything about it, they just develop.
yeah. What did your mother say? That was a
It was a stork bite.
It was a stork bite. My
bite,
mother
yeah.
said God kissed my sister. That was kind of a nice thing to do. But you know what? I got to tell you, with the technology the way it is today, the treatment can be done. The question is, how many treatments does it take?
Yeah, this was a very tiny birthmark. Some of them,
Right.
you've probably seen.
We're going to take a couple look at befores and
Some
afters
of them
in one
occupy
moment.
half the face.
Yes.
There can be complex involvement underlying brain and neural tissues. So you have to really see a doctor, and your physician would refer you on after assessment for laser treatment. The laser treatment really deals with what we can see on the skin, and it takes about 6 treatments over about 12 to 18 months to get one of the larger ones to fade. But they're very well tolerated. You can see
Yeah.
that lady had no topical freezing, no pain medication necessary.
And I'm guessing it's very individual how you can recover from this. I mean, some people just recover, faster than others. Is that?
No, absolutely. It
Yeah?
does vary, but it doesn't hurt. It just looks very bruised, and so
Yes.
people present a very shocking appearance.
Yes.
So I always tell people, you're going to look unpresentable for about a week. Just hang out and watch
Yeah.
some movies, read, go to the store with a shawl over your face.
Yeah.
But after about a week to 10 days, it fades very quickly.
Let's take a look at, you brought in 2 pictures
I
of
brought in
befores and afters. Yeah?
Examples of
Sure.
a very young child, and
Yeah.
sometimes.
Can I have it in the main monitor, please? Thanks.
As you can see, most of these occupy areas of the face, and even as see, that young fellow is agreeing with me.
Yeah, there you go.
Even as early as 10 years ago, we didn't have a lot of options to treat these, and so people would generally leave them because no one wants to exchange a birthmark for a scar that's more disfiguring. With the specific lasers we have now, you can see after 6 treatments, you have a fairly happy little fellow there. And again, this is very, very early treatment, and around the eye, you might want to do that because these get larger and can actually compromise the vision.
So I was going to ask you about the age. I know now, like for a lot of us, the technology is great now. So of course we're going ahead to doing this. But this you saying has to be done early because it could really take on more of.
Yes. As you get older, it can either, in the instance of an eye, it can compromise the eyelid and
Yes.
closure. But as you get older, they tend to get very, very dark purple, raised. You may have seen people in the street like that with little lumpy, bumpy parts to it.
Yes,
And,
yeah.
and that gets very difficult to treat at that age. So
Okay.
you want to definitely see your physician. If you have a child who's suffering from this, often parents will now treat before they get into the self-awareness ages, 5 or 6,
Yeah.
where they can get teased by their classmates.
Right.
And almost every major city in Canada will now have the type of expensive lasers that are used to treat these, and that will be covered by most insurance plans.
Okay, that's good to know. We have another set of pictures here that I'd like to take a look at. Yeah.
In the adult phase, a lot of adults have been told at one point or another growing up that you can't treat this without significant scarring, and so they've left it. And they're really quite happy when they can find out now that you can get a treatment that will improve this. This would be over 6 treatments, about a year to year and a half, and as you can see, in most instances, you can get almost complete resolution
That's amazing.
of the birthmark. So although it is sort of aesthetic in nature, it really it impacts people's quality of life because they now feel different about themselves. They project themselves differently. They end up walking with their face forward rather than walking like a crab sideways.
Yeah,
And,
yeah. What about there's no return of can they return?
There can be. What we're doing
Depends on what it is, though.
Yeah, there
like
are
I'm looking
deep
at this
roots.
the little boy that we
Yes.
saw, okay, and he had a little patch. Now, does the GP you're constantly watching for that to reoccur? Is that?
You should watch through the family physician
Yeah.
that there isn't little islands that regrow or get larger, and then they can easily be retreated
Yeah.
and touch up.
What?
Parents watch.
Parents watch, yeah.
Parents watch, and the parents are so aware. And when you have that type of dramatic change,
Yes.
it's so amazing, so terrific. Not only in that age group, not so much for the child's self-esteem because they're not even aware of that, but the parents' attitude and the way they respond to their child, and therefore the way their child will respond to them and to other people. Whether you're aware of it or not, often when we see our child as having some type of either disability or handicap, or what we perceive as a disability or handicap,
Right.
the way we treat them is different.
I don't know much about birthmarks. I don't know why they happen. I don't know if they can be prevented. And I don't know, is it always on a certain part of the body birthmarks happen?
They tend to, it's almost all genetic. It's
Yeah.
all in the genes. You can't always say that you're going to pass on those genes. There's no way of tagging it. There may be a family history and there's certain syndromes, but most of these aren't syndromes. A lot of them are just spontaneous events that occur, bad luck, draw of the genetic card, and there's no reason to feel guilty. No one's to blame. It's just random genetic event. And fortunately, most of them can be treated, and they tend to be located on the extremities or on the face, and in a certain distribution.
Okay, very good. Well, thank you. You're going to stay with us?
Absolutely.
Okay. I learned a lot about birthmarks today. I appreciate that. We're going to take a break. We'll be right back.